Welcome to the Alpha and Omega Health Podcast. We're here in February for Heart Health Month, and we're here to inspire you to own your health and wellness.
So, since it's heart, Valentine's, and all that other stuff, I decided to kind of brush out the pink or salmon. We can kind of get to that talking later. I even shaved.
I was actually going to comment on how handsome you look with that shaved
I don't
face
like
of
it
yours.
personally, but hey, making the wife happy. I like to have kisses. It's good stuff.
Let's get started with the Alpha and Omega Health Podcast with Doctors Rachel and Tri Myers.
It's important to talk about health for the heart. It is one of the top three, if not number one. I have to look it up. Changes seems to be every year. The number one cause of death in the United States. So let's talk about how to improve that.
I want to talk about my amazing technique first.
Of course you would.
But really, honestly, not just my technique, it's all chiropractic techniques are going to address the atlas bone, which is the first bone in your neck. You guys have heard us talk about it before.
Mm-hmm.
Try, do you remember, don't look at my notes, what the 9th cranial nerve is?
9th? Olfactory.
Oh my goodness.
I have to
You
go
get
through
it, right?
Okay, go ahead. I don't remember.
It's
What is
the glossopharyngeal. And what's
What?
number 10?
I don't remember. What is it?
The vagus nerve.
That darn one that wanders all the way through your body.
It does. The vagus nerve is the most complex nerve, and it starts out up in your brain and it goes all the way down into your abdomen. But the cool thing is about those two nerves is that they actually help with the sensory from the carotid artery, which is where the glossopharyngeal nerve is. It goes to the carotid artery, which is right in here, and helps you to know if the blood pressure is going up or down, or helps your brain to know that. And then the vagus nerve goes to your aorta. Do you know where the aorta is?
So it's a overarching part
It's at
of
the
heart.
top. It's at the top of your heart, and you have one in your abdomen. But we're going to talk about the top one. The vagus nerve goes into that as well and gives you the sensory to know blood pressure going up or down.
Mm-hmm.
And so, really cool. I'm getting a little nerdy here.
Go ahead.
Basically, if your blood pressure starts to go up, these nerves say, "Hey, brain, we need to vasodilate." What does vasodilate mean, Tri? Yes. Because usually what happens when our pressure goes up, we're having vasoconstriction, which means, can you say it in case people are listening?
I'm sorry. So vasodilate means think of like a water hose. Think of like the collapsible water hose. When something's going through it, it expands. And then when nothing's really going through it, the pressure's low, it gets smaller. The diameter gets smaller.
I've never heard of a collapsible water hose before.
Oh my gosh. You can tell who does the yard work around here.
Yeah, Jansen.
If you want it done right.
Oh my
Anyway.
gosh.
Love you, son.
Anyway, so basically the nerves tell your body, hey, we need to lower the pressure. So then it sends a signal down into your sympathetic ganglia. We've talked about sympathetic nervous system before.
Refresh.
Yeah, do you remember?
What is sympathetic nervous system?
Yeah.
Your fight or flight. You see,
Explain that.
I don't know, a snake pops out right here. My blood pressure goes up, eyes dilate, heart beats really quick because I need to get blood to my limbs so I can get the heck out of here.
Exactly. That's a great way to describe it. Good job, Tri.
Thank you.
Yeah. So so that's causing the vasoconstriction. And what we need to do is cause that dilation. And so when that sensory says, hey, sympathetic ganglia, let's decrease all that constriction, then it helps everything to open up so that the blood can flow like it's supposed to. But
So you're talking about the blood vessels.
yeah, that go to the heart.
Got it.
Yeah.
Okay.
Because if you're trying to drink coffee through one of those little tiny coffee straws, you're going to have to suck so much harder to get a good gulp of coffee, right?
Got it. Mm-hmm. Sorry, it just kind of seemed like when we were talking, it kind of was like a little confusing.
Okay.
So what happens
Why don't you
is,
simplify for us?
well, it's just whenever you need to get blood, because I said dilate because I was thinking about my eyes so I could see. But what she's talking about is whenever you need to get blood across a longer pathway or whatever quicker, you typically constrict it because it builds up pressure to hurry up and get there. Versus dilation, it kind of like calms it down. You can even think of like a body of water. So like a smaller the river is, sometimes the faster it is, and you kind of widen it out, it slows down the current. Same kind of premise applies to
So
blood
therefore, your blood pressure would drop.
Correct.
Anyway, so you've got your another big word, and maybe Mark will get this, at the bottom here. But do you remember the medulla oblongata?
They're over enlarged, I believe, in like alligators or crocodiles.
What?
Have you ever seen Waterboy? They have a larger medulla oblongata.
When I was thinking about that word, I was like, that's
Mama
from
said.
something.
Mama said.
That is right where the C1, the atlas bone is. And so if you have any kind of interference or pressure on the medulla, then you can have changes to those two nerves, which were what, Tri?
Glossopharyngeal and vagal nerve. Vagus nerve.
Vagus nerve, yeah. So then therefore, our blood pressure is gonna go up and it's not coming down. Now, this is not always the case, and we'll talk about that in just a second. So there was a study from a doctor in Chicago because he kept seeing that these patients that were going to chiropractors, their blood pressure would drop like 20 points, and he didn't understand what was going on. So he kind of did this randomized study and found out that with the Atlas adjustment, it was actually helping to lower these people's blood pressure. So outside of just misalignments in the Atlas,
sure,
what else would you like to talk about when it comes to the heart?
I mean, you go anywhere, like your medical doctor, primary care, or whatever. So what they typically tell you, like if you have a heart issue, they were like, okay, you need to fix what? Diet and exercise. You need to eat right and whatever.
Who are you saying tells you this?
Hopefully your doctor does, your medical doctor that's there. I mean, hopefully it's common knowledge. It's not like this is an epiphany or anything. Like this has been around for a year.
That's true.
Or two. A year or two?
A year or two?
Yeah.
Okay. I'm going to just speak from what I hear. I don't typically have patients telling me that their doctors are telling them to change a lot. A lot of times they're just being given medications, right?
True. They might give them like a handout and be like, hey, here, do this. I'm not saying that they actually walk you through that whole process, which is what you should be doing versus just taking a pill to kind of offset some blood work or metric that you're trying to fix. It's like, why is that metric high? So blood pressure, why is it high? Your cholesterol, why is it high? All these other things, why is it high? Instead of just taking a pill to
because you're not
make your lab
deficient in
correct
that pill.
So a lot of those things will kind of just alter the way the body functions instead of just letting it function correctly like it's supposed to. So the good news is, like back in the day, they used to say food was medicine. So, and also we didn't sit behind a computer and all the other jazz, so we were a lot more active. You had to work for your food and hunt for your food, whatever. So diet and exercise are huge. Now, one of the kind of things that is a big thing is like people always think of like fat. Like, okay, cholesterol, can't eat fat, can't do this kind of fat. All fat's bad.
Cholesterol in my eggs. Can't have eggs. It's the worst thing ever.
So what kind of fat's good? What kind of fat's bad? So when you kind of look at your body, you have two different types of fat. You have what is it called? The subcutaneous fat, which is the kind of stuff you can kind of feel and see, the less attractive kind of fat. Then you have your visceral fat. It's the fat that's around your organs. Okay, then that's the one that is important as far as like heart and organ function and just health. We have an in-body test, so it kind of does a bioelectrical impedance to kind of look and see how much body fat and visceral fat you have. So you'd be surprised how people really tiny wise, you're like, oh, they're super skinny. You get it, and like, oh, your visceral fat and your muscle mass are kind of weird. Like you should have a little bit more muscle mass than visceral fat. So that's a test that we like to do. So our whole thing is, what is our mission statement again?
To inspire people to own their health and wellness.
You got to own it. So
how are we going to own it? Let's
so
get on track
first off,
here.
go back to your chiropractor. If you got high blood pressure, you got some issues to deal with, get on top of that. Get on top of your visceral fat, because they've done
How do you do that?
They did a study in Princeton. They were saying if you have higher levels of visceral fat, you will have a higher predisposition to strokes and heart attacks. Everyone's always worried about time. It's a big one. I mean, we own businesses. We understand that part of it. So look up high intensity interval training. What can you do to try to get the heart rate up and then the heart rate back down? Reason why that's important versus a steady state heart rate. Say if you had a little kid running around the pool 50 times and come back and sit there and talk to you, ask you questions, can I have ice cream, whatever. They're not gasping for air. They're not even acting like it's even bothering them. Me and you go run around that thing 2 or 3 times and be like, give me a second. And then honestly, true gauge of like health, especially heart health, is how quick your heart rate can go from high to back to baseline. Okay, so that is what we want to try to do. Like, think of grandma if she did that. She'd be like, oh my God, you're gonna die, stop. So we don't want that. So what do? You train. You train your heart to go up, and then can it go back down? Don't go back up until your heart rate comes back down. So at first, it's very hard. It might take you a few minutes to get you back to baseline. As you improve, it can yo-yo back and forth.
Your heart is a muscle.
Correct. You're training it.
And you're training it.
So
So what he's saying is, do these high intensity workouts. That's going to help to work your heart because it is also a muscle. You can also look up Tabata. I don't think you said that. But
it's hard.
it's hard, but you start where you can. And it really is about 15 minutes. I'm going to tell you right
True
now.
Tabata's 4 minutes.
A total.
Yes.
Total of 4 minutes.
2010, 2010, 2010. Yep. Besides diet, exercise, and getting adjusted, everyone wants to know what kind of supplement you can do.
Omega-3s.
What about omega-6s?
No. So the way that you can get omega-6s and omega-9s are going to be coming from eating some Bojangles.
Mm-hmm. We love our Bojangles.
You love your Bojangles.
That's why I have a little bit more visceral fat than I need to.
Subcutaneous fat,
Hey,
you
don't
mean?
be judging me. I'm working on it.
Anyway, but yes, your omega-3s. So you typically want to be able to have about 3 grams of omega-3s every day.
Mm-hmm.
And then that also includes you actually decreasing your 6s and 9s. So getting more of your fruits, vegetables, and lean meat versus your, Jingle bells, Bojangles.
Yeah. So typical, like if you don't like to eat fish, don't like to eat a lot of nuts, and don't like to eat a lot of, the oils and stuff like that, supplement it. It's a good thing to have. That ratio is important. So we're not saying that all 6s and 9s are bad. It depends on where you get the 6s and 9s from. So you can get it from like your eggs and your meats and your cheeses. Like those are good quality 6 and 9,
already.
but you're looking for a ratio. Mm-hmm. So good quality fish oil, supplement is good. Typically omega-3, you want it to be as clean as you can. Typically from what we've seen, krill oil ones are good. All right. Another one that is also good is CoQ10. They did a study, I think it was in Harvard, where it's talking about post-heart attacks. Mm-hmm. The tissue that needs the most CoQ10 is the heart. So the reason why, what CoQ10 is it's a kind of like an anti...
it's like the fountain of youth.
Yeah, it's pretty darn good. It's like a free radical eater. It really helps the mitochondria, which is the energy producer in your cell, generates that ATP, so it allows it to function better. So it's kind of like a boost, an energy boost in your cell. So since your heart is a muscle, it needs a lot of it. We want you to think of getting healthy on the inside first to look better. You have longer results versus I need to lose the fat and then I'll get healthy. Like no, you get healthy and then your body will naturally lose the body fat. Okay, so.
And whenever you aren't feeling good, sometimes you just don't want to go and work out, and you don't really, you want to have those comforting foods and that sort of thing. So that, for me, what I would say is get checked, especially if you've got some heart stuff. Get your atlas checked. Mm-hmm. Make sure that's where it's supposed to be, and then go from there. Your chiropractor, or if you're coming to see us, we're going to talk to you about these other things that are great, and it's going to supplement your health. But ultimately, your body is functioning because everything is in line. Because the nervous system, the nerves flow from your spinal column. So,
that's about it, I think.
And until next time, I hope you own it.
Yep. Hey, comment at the bottom if you have any questions about anything we're talking about or want us to talk about anything in particular. So, look forward to talking to you next month.